We are connecting to YouTube now. Just a couple more moments, please. Okay, I will step out of the way. Have a great meeting, guys. Thank you.
Thanks, Daryl. Whenever you're ready, Dr. Gocher.
Okay, thank you. So my name is Jack Gocher, and I am chair of the Board of Health, and I would like to call this meeting to order today on the 17th of June. And with the first order of business is to establish a quorum. So Narda has talked to me about going through a roll call with everyone. I believe we have a quorum established, but Narda, if you are online, if you will go through and everybody will just answer as we go through the roll call.
Thank you, Dr. Gocher. This is Narda Capicelli. Roll call. Diana Drake.
Here.
Dr. Gocher.
Here.
Mayor Glenn Jacobs.
Here.
Dr. Maria Hurt.
Here.
Dr. Patrick O'Brien.
Here.
Dr. James Shemaya. We knew he was going to be absent, so he is not here this evening. Dr. Marcy Souza.
Here.
Lisa Wagner.
Present.
And Dr. Buchanan.
I'm here.
Okay. That's it, Dr. Gocher.
So if we have a quorum, and I believe we do, then we can conduct business. And the next order of business would be some quick introductions around. So I'll introduce myself first. My name is Jack Gocher, and I'm an oral and maxillofacial surgeon at UT Medical Center and am chair of the board this year.
Okay, I'm Diana Drake, and I'm the pharmacist representative from the Tennessee Valley Pharmacist Association.
Thank you. Lisa?
Hi, I'm Lisa Wagner with Knox County Schools, and I'm here for Mr. Thomas, the superintendent.
Thank you. Dr. O'Brien?
I'm Pat O'Brien. I'm an emergency physician. I'm currently an active duty Air Force officer serving the Air National Guard. I'm the EMS medical director for the City of Knoxville Fire Department and practiced for many years in Knoxville, mainly at UT Medical Center Emergency Department.
Dr. Souza?
I'm Marcy Souza. I'm an associate professor and director of veterinary public health at the UT College of Veterinary Medicine.
And Narda, if you will introduce yourself.
I'm Narda Capicelli. I'm the executive assistant to Dr. Martha Buchanan here at Knox County Health Department.
Thank you. Ms. Hurt?
Dr. Maria Hurt, clinical.
Oh, sorry, doctor, I'm sorry.
It's okay.
Missed it,
Clinical
sorry.
assistant professor at UT College of Nursing, a representative from Tennessee Nurses Association, and previously employed by the Knox County Health Department as the pandemic emergency preparedness nurse trainer and educator.
And let me see where I am in the scheme of things. Dr. Buchanan, I see on the screen.
I'm Dr. Martha Buchanan, the director of the Knox County Health Department.
And Mr. Jacobs.
I'm Glenn Jacobs. I am mayor of Knox County. I'm the odd person out here because I do not have doctor before my name or any sort of MD afterwards. But thank you all for being here.
Thanks. Good to have you on board. Mr. Hobby.
Daryl Hobby, I'm just the IT guy setting up the Zoom meeting.
We love it. Thank you.
Thank you.
And let's see. I've got Catherine Killen up. I'm just looking at my screen here, trying to make sure I've got everybody accounted for.
Hi, yes, I'm Catherine Killen. I'm the Deputy Senior Director of Strategy for the Knox County Health Department.
Okay. And I've got Dina Mashburn up next.
Yes, this is Dina Mashburn. I'm the Director of Nursing for the Knox County Health Department.
Thank you. And I've got Mark Miller up next.
Dr. I'm sorry, I don't believe he hit, oh,
Mark is muted.
yeah, Mark is muted, I'm sorry.
See? Oh, there he is. Okay. Marcus, he
Okay.
may have stepped away from his desk.
Okay.
So
And I've got
he's-
Zach Webb up next.
Oh, I'm Zach Webb. I'm the Chief Technology Officer for Mayor Glenn Jacobs.
Okay. I've got Myers Morton up next, and
This is Myers Morton. Pardon me, Doctor. I'm Myers Morton, the Knox County Law Director's Office, here to
Thank you.
provide advice if necessary.
Thank you, Mr. Morton. And I've got Kevin up. And I'm not getting it.
Yeah, Kevin is our finance director, and again, he's listening in. So he again may be doing something else. He may have
Okay.
stepped away from his desk, but
And
he's our
Brian
finance
here.
director.
Brian here next.
Dr. Brian's my chief of staff.
Oh, very good. Okay. Thank
He
you.
may just be listening in as well.
Okay, thank you, Mayor. And I've got a phone number at the bottom, which is 898-1551.
That may be somebody who's called in.
Okay.
Not sure who that is.
Did I miss anyone?
This is
Okay,
Brian Hare. I was having audio difficulties. I'm sorry about that.
No problem. Thank you, Brian. Thank you. So again, we have a quorum and have been introduced. And I will read to you from our notice about the purpose of the meeting. And then I'm going to turn this over to Dr. Buchanan for more details about that. But the purpose of the meeting, according to our notice, is to review and consider how Knox County reopens following COVID-19 closures in accordance with the Safer at Home Order and Tennessee Governor Bill Lee's Executive Order 16, and also with our Knox County Board of Health orders that were done. So with that, Dr. Buchanan, let me turn this over to you for a more detailed purpose of meeting and then background of our reopening plans, if you would.
Sure, thank you. And first of all, I want to say thanks everybody for taking time to be on this call this evening to help us guide us through making some important decisions for our community. And I do want to take a few moments to give you some background. The pandemic is undeniably new territory for all of us. The basics of a reportable infectious disease that we, the health department, respond to by identifying cases and contacts and placing those people in isolation or quarantine is not new. We do that almost every day. The all-encompassing impact of COVID-19 has had on our community is what is new. This isn't a single isolated outbreak with some cases of an infectious disease only really impacting a specific group of people. This is an outbreak that touches every aspect of our life, of our lives, whether you have COVID, whether you're a contact to a case, a business owner, or just happen to be alive right now. And so unprecedented decisions and unprecedented times. Shutting down, though it was a very difficult decision to make, was not nearly as complicated a process as reopening. In my role as the public health officer and with the law department's assistance, I wrote the Safer at Home public health order. Once the order was issued, we began discussing a data-driven reopening process and what would that entail. We turned to what we always turn to in public health. We want to provide guidance for our community, a task force or a coalition of community members who has expertise we don't have and represent our target audience. It's a tried and true method and even required for national public health accreditation. And I would also like to add, I believe it resulted in a very comprehensive guide for reopening that I still stand behind. Through executive order, the governor gave the 6 metropolitan areas, including Knox County, permission to have their own plans that could be more or less restrictive than state guidance. And so we move forward with the task force, with that task force model for which there is precedence here in Knox County. After several meetings, we were informed in mid-May that we needed to sunshine and or open the task force meetings to the public. We attempted to do so, but prior to the meeting learned it had not been done properly. So we decided to cancel that meeting in the interest of transparency. We didn't want to have another meeting that wasn't properly noticed. In further discussions with the law office, we were advised that the Board of Health needed to be the body that reviews and approves any guidance on reopening, since it is a policy under the current declaration of an emergency in our state. This was a change from our historic precedents for the Board of Health, which had always acted in an advisory role, and not as a policy-making body. And honestly, the health department hasn't been a policy-making body either, so kind of new territory for us as well. So here we are in completely uncharted waters with changing guidance from different levels, federal, state, legal, over time, and impacting how we do our jobs and how we accomplish our task of advising our community. So my desire for today is that, or my purpose in calling you together, is that we leave with a clear path on how to continue to provide guidance on reopening that helps reduce risk and minimize the impact of COVID-19 on our community. So it's pretty simple purpose, a lot of details behind that, but that's kind of the background. Any questions from anybody on that? And that's really all I have for the purpose, Dr. Gutcher. Do you want to move on through the agenda, or?
So the next item in the agenda after purpose, and again, I think that was very well stated, and really appreciate that. But the next on our agenda is background of reopening plans, and there were 2 links for references. But Dr. Buchanan, if you can give us a synopsis of those background of reopening plans.
Well, that's a real challenge. That's why we sent the links out beforehand, and I'm hoping everybody had time to look at those. The reopening plans that were created locally and the reopening plan that was created by the Economic Recovery Group at the state level are lengthy documents that provide guidance, some overarching guidance for the community about wearing face masks and washing your hands and staying home if you're sick. That's in both plans. And then there's some specific business guidance for specific types of business. And there's some, we call businesses slightly different things. And there are places where the Tennessee Pledge is less restrictive than the local plan. There are places where the Tennessee Pledge is more restrictive than the local plan. Those are just general overarching guides. And again, I'm hoping you had time to read them, because we do need to discuss those and, where we go from here this evening. So I don't know if anybody had an opportunity to look at them and has any specific questions that I can try to answer. Questions about the Tennessee plan are a little more challenging. And then questions about the local plan for me, but certainly can try to answer those questions. And both plans are kind of phased. Our plan is based on benchmarks that are similar to what the state is using to guide them, and based on caseload, public health preparedness, hospital preparedness, deaths, and I'm missing one. Caseload, testing. I apologize. And based on testing. So the Tennessee Pledge is very similar to ours in that it is also phased. Their benchmarks are not exactly the same, and but they are using those same benchmarks to provide information to the public as well. So with that, I'll entertain any questions anybody might have.
Hey, Dr. Buchanan, I'll go ahead and kick it off. First of all, just thanks for all the great work that you and the health department has been doing. I think it's pretty remarkable when you look at the number of cases that we've got here in Knox County. compared to a lot of our metropolitan areas. It's really pretty impressive. I think it's a commitment of you as well as our citizens. My question is, so you have the 5 benchmarks. And so how are you going to actually use those to decide whether to go forward or backward or stay in the same phase?
Sure, that's a great question. So when we look at those benchmarks, the reason we chose benchmarks, more than one benchmark, because to make a decision based only on one piece of information is really not a well-informed decision. And, the cases and other things don't happen in a bubble. They happen in our community. And public health decisions don't happen in a bubble. They happen in the community. We know that the decisions we make have economic and life impacts for everybody. So when we look at, looking at our caseload, we expected that to go up when we started reopening. Really looking at that trend, how sharply is it going up? Is it leveling off? Or is it really just continuing to go up? When we look at testing capacity, is our testing capacity staying the same, going up or going down? In addition to that, how quickly are the tests coming back? Because if y'all recall, we had in the beginning, it took 5 to 7 days or longer to get test results back. How is that getting better or is it getting worse? That's another piece of information that's important in reopening, because we know cases are going to go up and we know we need more testing. And then when we look at public health capacity, we recently shifted this benchmark just a little bit by looking at how quickly we can contact cases and how quickly we can contact their contacts, because that's the most important piece of what we do. It's not the number of people we have working, that's important, and we need those people, but how quickly we can contact somebody and say, hey, you have COVID-19, here's what you need to do. Who else have you been in contact with? Contact those people and tell them what to do, get them in a quarantine or isolation, and find other cases that way as well, because we'll find cases when we do that. And then when we look at hospital capacity, one of the reasons we initially shut things down was for the hospitals to sit down and kind of build their capacity and build their surge plans. And we're really fortunate here in Knoxville that all of our hospitals work together and coordinate, and they actually have a shared surge plan where they agree they'll step forward if they need to and reduce surgeries again. But they did that together, they built up their capacity, and now we have that. And even though we have increased hospitalizations, our hospital capacity remains really in good shape. And then when we look at COVID deaths, we've been very fortunate in that we've only had 5 deaths. That certainly can change. But again, looking at that, is that staying the same or going down or going up? So take all of those things together and help decide, should we, as a community, is it the right thing to move forward or not? And, we moved into phase 2 because things were moving in a positive direction. If you listened to last Friday's update, our benchmarks last Friday also looked good. And except for our case counts had gone up, but again, we expected that to happen. We're not seeing the large spikes that we've seen in our other counties, and we're fortunate. We're grateful for that. We also acknowledge that could change, but again, not that one piece of information really isn't what we would want to make a decision on, but all of those pieces of information. Does that help? Any other questions?
Dr. Buchanan, go ahead. Whoever was ahead of me.
I think she's good.
Okay, Dr. Buchanan, I had some questions relative to other large counties in the state. And I guess we can take Davidson County as kind of a good example and help us clarify this. But my understanding is that they're having a greater degree of problems in Davidson County, maybe a larger caseload, maybe the curve is increasing faster, and I don't know whether their hospital caseload is at any critical stage, and compare with them. And my understanding, and you can help me with the details, is that they're going to be slow to progress in their opening because they're starting to see an overwhelming load. And what are they doing different? What are we doing different as a baseline? And how do we compare with them? I guess is a good question.
Okay, that's a great question, and it's the answer is nuanced. For starters, obviously Davidson County is a much larger population than Knox County is. So their per capita or their per population caseload is higher than ours. I think when we go back and look historically, what we can see is that when Knox County put the safer at home orders in place, we were at about 13 to 15 cases. When they put their safer at home orders in place, they were at about 100. That makes a difference. They started from a different place than we do. Add to that, Nashville is a much more densely populated community than Knox County is. And so that also contributes to the spread of this disease. If you look around the country, you see it spreads more easily in those densely populated areas where people really just can't socially distance well. And so that happens. Those are two things that are theories. I don't think we'll know for sure what the differences are and what made this look so different in our community than other communities until well after this is over and we have time to take a breath and go back and look at the data and really learn from it. We're not able to do that right now, but those are some things that my staff and I have talked about, and we've even talked about with the State Department of Health as well. You look at Chattanooga, I think they're puzzled as to why their numbers have gone up as well. I know that they've had some clusters, some larger clusters that we haven't had related to industry, but they also have had widespread community spread as well. So it's interesting how this illness looks so different in communities, even in the same geographic areas. So those are some things that I believe are happening. I know that I do believe that they did not move to phase 3. I know for sure that Shelby County didn't move to phase 3 because their case counts had gone up so dramatically since Memorial Day. Our case counts have gone up, but not dramatically. And so we continue to be pleasantly not surprised, but we think our data looks good. We are concerned about the case counts going up. We're concerned when we get more than 20 cases a day, but that's only happened occasionally. And so we continue to feel good about where we are as a community. That doesn't mean people can stop what they're doing. We need people to continue, following those 5 core things: wearing a mask, washing your hands, staying home if you're sick, cleaning surfaces regularly, and maintaining social distancing. All those things need to continue in order for us to move forward, no matter what we decide tonight, in order for us to not have increase and to not see some of the spikes that we may have seen in other places. Does that answer your question, Dr. Gutcher?
Yes, it does. One just quick point that maybe you can help us with, and that was hospital capacity. And, I can speak from the data that we get every morning at UT, that we have 4 inpatients and we've got about, it's either 26 or 28 folks that are awaiting testing, which may be folks that are being moved to skilled nursing facilities, for example. And I don't know about the other hospitals, but I assume that even in the event of a large increase in cases, that our hospital capacity is pretty well buffered or capable at this time. Is that your impression?
That is correct. And I'm sorry. Okay. I don't know if Kat, can you pull up our data, and maybe I may have Catherine screen share our data with you, because I don't believe I'm skilled enough to do that while I talk to you. Our hospital capacity is adequate at this time, and even for more patients. And even when we look around the state, hospital capacity remains pretty good because everybody pushed the pause button and built up their capacity and came up with plans so that they can really allow more hospitalizations. And they also coordinated so that if they start seeing an increase in cases in the hospital, they can also course correct quickly and stop elective procedures if needed in order to further increase that capacity. So again, I'm really grateful for our hospitals coordinating the way they have, so that they can do that together and not separately, so that our entire community benefits from that. So what Catherine's pulled up and shared with you is our the regional hospital inpatients that are positive for COVID is the top graph. And you see the inpatients and ICUs and ventilators. And This data is, we update this, I can't remember now, weekly. And so this data will be updated on Friday again. We're looking at it, and the hospitals, as you said, are looking at it daily. The hospital executives are talking at least once a week now to talk about how things are going, what challenges they're seeing. So it's really a coordinated effort, which really benefits our community. I can't say enough for that. And these are folks who are waiting for test results. They may be sick and in the hospital. They may be waiting to go back to a nursing home. That's also possible. And then if you look at our available capacity at this time, all beds 25, almost 26%. ICU beds were about almost 11%, and ventilators at 63%. Those are pretty good numbers. I know that 11% ICU beds might make some of you scratch your head, but that's not unusual to be at that spot for our hospital systems. And this is for the whole region. This data is not just for Knox County, it's for our entire region. So that's important to note as well. So it includes non-Knox County patients in this data, because that's the way this data is available to us through the hospital resource tracking system. It's by health region. Does that help?
Yes. One other question about hospital beds and ICU beds. I know at our hospital we have specific acute care beds and ICU beds set aside for COVID positive patients. Are those the numbers we're seeing here, or are these all ICU and all acute care beds?
So the first graph, the COVID-19 positive hospital inpatients, that's all positive patients across the region.
Right.
And so that's all beds across the region. And then that down there, if you see it looking at the capacity, that's all hospital beds, not just specific to COVID. So the first graph is positive patients. That's just, those are numbers. And then the second graph is those waiting lab results. And then that final graph is really about the full regional capacity, not specific to any COVID at all.
I'm assuming that all the hospitals have in their plans set aside isolated areas, specifically for COVID positive patients that are sheltered from the other acute care and ICU beds. So the actual number that's set aside, I think, would be a lot less than that. But I think everybody's still under capacity as far as I know. Do you have information or knowledge about that, Dr. Buchanan?
And so you froze for a moment.
Oh, I'm sorry.
So let me restate your question really quickly. So I think you asked me if everybody has a dedicated area for COVID-19 patients. And the answer to that is every hospital has their own internal way they're managing COVID-19 patients and protecting staff and other patients from those COVID-19 patients. I don't have the details of all of those plans. Those plans are based on, facilities, infrastructure, staff capacity, what works for them, all of those things. But they're all operating together in kind of in sync. Decisions about whether to let visitors in, they're making those decisions together. So they're being very thoughtful. So our hospitals are doing a really great job of managing. And again, fortunately, we've had a very low caseload in the hospital.
Thank you.
Sure. Yeah, so yeah, I have to take that down.
Dr. Buchanan, can I ask a question of you, please, ma'am?
Of course, sir.
Benchmark number one is the one that has had problems, let's say, or has been in the red. Have we had a period of time where that has been yellow or green?
Oh, absolutely. Back before we moved into phase 2, it was green for several days. So one of the things that's happened with that is expected. It's not unexpected. With that data, we were getting such a small number of new cases each day on the vein of like less than 10 each day. And now we've jumped up to 15 to 20 average, 15-ish. So with such small numbers, any change is statistically significant. So what we want to see with that is that that over time it will kind of level off and we'll kind of stay like before. If you remember, we kind of got stuck, like we were having like 6 new cases a day for a while. So we want to kind of get to the place where it levels off and we have just, maybe 15 new cases a day for a while. And so we know that we could still spike, but we've leveled off. And that's what we're talking about, flattening the curve, is seeing that rate of increase level off so that we're not continuing to have an increase rate. That's what we're worried about, overwhelming our hospital system. Because if that rate of increase gets too high, we run the risk of overwhelming our hospital system. In addition to that, we will inevitably see more people pass away from COVID-19, which we certainly don't want to see that either. I'm comfortable with what we're seeing as increase in the recent past since we've opened things up a little bit. I think we just haven't had enough time for that to level off yet, but we'll continue to watch the data. And I think one of the things we'll talk about eventually this evening is how do you want to use that data to guide our community?
Thank you.
Sure.
Dr. Buchanan,
Yes, sir.
could you please go back to the hospital capacity?
Sure.
There is a chart that has additional surge, both beds and ICU beds.
Oh, did I skip that
ICU
one?
beds is, no, that's okay. No, just could you please explain how that works?
Catherine's going to pull it back up. Sorry. So all of our hospitals. So if you look at the very bottom of that additional surge capacity, all hospital beds, ICU beds, and ventilators. So this is if the hospital, all of the existing hospital beds are full of patients, and the hospitals have to go to reducing surgeries and reducing use of other areas in the hospital and put patients in those beds. That's the surge plan. So that they have the additional capacity to add 4,389 just plain old hospital beds, 543 additional ICU beds, and 374 surge capacity ventilators. So we still have that margin to be able to use. We haven't even tapped into that yet. Haven't even gotten close to tapping into that yet. So thanks for asking that, Mayor. That's a good question to go back and point out. They have plans to be able to do that if we need it, and we're nowhere close to that. So again, that's why we continue to feel positive about where we are and being able to allow our community to open back up with guidelines. We focused in phase 2 on saying, how do we help the community open back up? Because we know businesses need to get back to business safely. So what guidelines can we put in place that help keep people safe? And we can do this and people can, again, get back to business. And so far, I think the community's doing a really great job of that. Any other questions, concerns?
Dr. Buchanan, I have a question that you may have access to through the health department, and that is, you talked about the 5 measures that we need to control more rapid spread of COVID. How effective are we at actually performing that in the community as businesses open up? I think that's in general kind of a concern that citizens will start to relax and try to get back to the way things were, and it could precipitate a problem. I think that's an underlying fear we all have.
Mm-hmm. And that's a reasonable fear. But I think the data will show us that because if people are doing those things, we know that social distancing, mask wearing and washing your hands, cleaning surfaces and staying home if you're sick, we know those things reduce the spread of this disease. We know there's evidence to show that. We showed it, we demonstrated it when we really were in the phase 1, when we were at the very beginning, or at the beginning, not in the phase 1. And so the data will show us that. We'll see more cases. We'll see an increase in our case counts. We'll see more clusters at workplaces. We've had some clusters at workplaces, but I'll be honest, we've been very pleased with what they're doing and how they're working to keep their patrons and their employees safe. And our goal whenever we have a cluster is to go in and work with them on what can they do to improve their safety, to improve allow them to continue to operate. And we've had great cooperation from the employers that we've worked with. So as long as we continue to see that, I'm not terribly worried. I think we have a very responsible business community here in Knox County, and they're taking this seriously. You have everybody can tell me about outliers, and I get told about outliers every time we have a press conference, I think. But I think those really are just the outliers. I think most of our businesses are taking this seriously, and our citizens are as well. And again, the data will tell us that. We have no way of tracking who's wearing a mask and how many people are wearing a mask and how many people are social distancing. But we do know that we'll see more cases if people aren't doing those things. I mean, a lot more cases. I know we're seeing more cases, and that's expected.
Just to speak as somebody who has observed the community and looking out there, I am getting a little concerned as we move forward that the public, me, families, friends, are starting to get a little more lax, and we just need to encourage everybody out there that we're all in this together. When I wear my mask, I'm protecting you. When you wear a mask, you're protecting me. And I want to make sure that everybody understands that please do not step away from that. I have in the last 5 days noticed fewer masks when I go out. Businesses have been doing a great job with their employees. I have no beef with anybody I've seen with the businesses, but I am a little concerned about just everyday people who are not thinking about that as much right now. They're feeling like that they can get out. I know other people around us, state of North Carolina today is looking at doing masks for everybody mandatory. They are looking at that today and tomorrow. I hope we don't have to get to that. I hope we don't have to step back, but I want to just make sure everybody hears that those things, washing the hands, the masks, et cetera, are vitally important. It's not time to let up on the gas on that, and that we just need to keep moving forward on that. That allows us to open up quicker and to stay open. Mm-hmm. We don't have these issues, and I don't want to see that given what I've seen in the recent days in certain areas of the county, not everywhere. A lot of people are doing a good job, but it's probably not a majority of people wearing masks out there right now when they go out in public.
You know, and people have an option. They can social distance or wear a mask. It's not both. I mean, you can do both. That's great too. And, you know, it's not that happenstance past the person in the grocery store that's going to give you COVID. It's stopping and talking less than 6 feet apart for several minutes that's going to potentially spread COVID. So that's another thing that I think is important to keep in mind. And you're right. And I think we're carrying that message. Obviously, I think people are tired of hearing that message from us because we've been saying it for a long time. So we need other community leaders like you all to carry that message as well. That, you know, we're in this together, and you'll understand this, Dr. O'Brien. It's mission critical that we all stick to the plan, because if our mission is to reopen our community, we all have to do the same. We have to keep doing that same thing. And we want to empower our community members to say, I can take a role in making sure my community moves forward. And each member of our community has a role to play. And they're not hard things to do. And they can choose to do that and choose to be part of the mission of moving forward. Everybody can make that choice for themselves.
Thank you so much. One other thing that has come up, I've had questions in the last week. We're talking about a phase 3 reopening in Knox County. I have been asked by a number of people, well, what does phase 4 look like? So at some point, I'd like us to have that discussion of what are even the next steps, or are we not even at a point where we can start that process? But we do want to move as quickly and as using scientific evidence base into these different phases. All we have in front of us right now is phase 3.
Right. So there are a couple of things. Yeah, there are a couple of things that we kind of need to talk about. One of the needs that we have tonight is and Myers, you may have to chime in and help me, is before you is a decision to decide about, we have 2 separate plans, the local plan and the state plan, is to decide, do we shift toward the state plan? They are very similar. In the beginning, it was much less guidance, and it was We were concerned about what was going to come out of the state, and we didn't know, and we felt a responsibility to the community to get something written and out there so people could start doing things safely, and we did that. At this point, there's a ton of guidance that's out from the state. It's very similar to our guidance. Do we, is phase 3 for us moving under the state's plan? There's some things that would have to change here locally. We have a large group of people who are providing guidance for a business community. One of the things we've kept out in front of us this whole time is, people want to know how to do this safely. People need information. And we've created a whole bunch of volunteers who are helping us. We'll have to help them understand the Tennessee Pledge better. So it'll take some time. We'll have to decide as a board, how do we use the benchmarks? Do we use them to just provide information to the community and say, hey, you're doing a great job, things look good. You're not doing a great job, what do we do with that? How do we use those benchmarks? I think they're important. I think people like them. I think people like that information. But one of the big things we have to decide tonight is, what plan do we move forward with? In thinking where we've been is that because of the similarities, and in addition to that, acknowledging that lots of business people have businesses in Knox County and in Anderson County, and they're operating differently now, which is hard. We get that. It's hard to have two different guidelines. It makes sense for us to fall under the state at this point, from our perspective. And I know the law office has advised that as well, that falling under the state plan, they've recommended that. And if you have questions about that, you can ask Mr. Myers or Mr. Morton.
Chime in, Doctor.
Yes, sir.
I want everybody on the board to understand that currently, as we sit here, there are no orders in effect. There's no recommendations. There are no phases. There are no benchmarks. There's no local plan. Only this board has the authority and power to issue those plans and benchmarks for reopening. And it's been our recommendation to the health department, and I'll try to make it brief, to not exceed what the governor orders. Legally, if we do not exceed what the governor orders, Knox County is immune from lawsuits. If someone wants to sue us for their liberties being taken, if we do not exceed what the governor does, then we're immune. And that's the advice we've given the health department. But this board is the sole board that has the authority to decide what the next phase is, how to reopen. And it's our advice, do not, at least just advice, all it is advice, is do not exceed what the governor orders. Okay, that's it. Thank you, Doctor.
Thanks, Myers.
Can I ask a quick question?
Sure.
So in the other metropolitan areas across the state, so have they also had task force that worked on similar plans that were implemented at the county level?
They have in Shelby and Davidson County, both. The other metropolitan counties have not. So they have, and they have task forces that are meeting and advising periodically and regularly. Some of it's more fluid than others. Some of it's more formalized than others. Because I did reach out to my counterparts in those counties to see what they were doing.
And so I guess in those counties, is it safe to assume that their similar Board of Health had to also approve those plans that were put into place?
Yeah, this is Myers again, Doctor, pardon me. I think, correct me when I'm wrong, Doctor, there are only 6 counties in the state that have this type of Board of Health. That's why the governor excluded the 6 counties from his orders, because there's no Board of Health, and the Knox County ordinances, the charter adopted this structure with the Board of Health. That's why the governor segregated the 6 counties, including Knox County, because those counties are the only ones with a Board of Health. Is that
right?
Correct. And I guess I understand that, but I guess my question, and sorry for not being clear, but so I guess in Shelby and Davidson County, did they, with their local orders, were their board also involved in that discussion and the approval? They actually voted on it? I guess I just want to be clear, like, because I've read the executive orders, and it simply says that that the health departments have the authority to issue it. And I guess I'm just not clear on what that means.
So Again, I'm obviously not, I don't have the details of how Shelby and Davidson are operating. But in my reaching out just to see what they were doing, their task force are different than their Board of Health. They're operating differently than we are. And I'm assuming and that's an assumption, that they have, their legal guidance varies from our legal guidance. I'm, again, not a lawyer, but I do know they're operating differently than we are.
One thing I noticed, I looked at Davidson County's information today, and on Monday, they made a decision to remain on phase 2 and said they would probably reevaluate in about another week. Now, they are probably 12 times the numbers we have. We're looking also at Shelby County, much the same, and they, I believe, are holding. They're not moving ahead. So we're in a much better position to move ahead into what has already been planned locally, that we could acknowledge, I guess, as the Board of Health into phase 3. It's just deciding how far do we go, and are there any other recommendations we need to make while making those changes into a possible phase 3.
Right. So yeah. So if we, my understanding, again, Myers, you'll have to chime in if you need to. My understanding is if we choose to stick with a locally written plan, that would be something the Board of Health would need to review and be part of and approve and be part of the creation of, which, we can certainly do that. That would mean, meeting more regularly and all of those things. However, if you were to choose to move us as part of moving into phase 3, move us under the state's plan, you could make that decision this evening and provide that guidance to us to do that. And then we would move forward that way. We would continue our support of the community. We would continue with the things we're doing. We have a hotline. We have all kinds of ways for people to get information. We would have to update that. So it's not going to happen overnight. That would take some time to get all of those things in place to support our business community, because we don't want to just go, okay, everything's changed. But I do agree that we're in a good place to move forward. And so that, again, is something for you all to discuss and decide. And I'm here to advise and provide you with information. And Myers is on the line to advise you on the legal things, since that's his expertise. And Myers, did I get that correct?
Yeah, one point I'd like to make, please, doctors. This board's not going to review phase 3. This board is going to create phase 3. It's this board that does that.
Okay, I didn't mean to say review. If I did,
that's fine. I mean, this board is the only authority in Knox County to decide how the community reopens. This board. Okay.
Okay, and then so I guess given what we've talked about tonight and where we are, at some point we will want to vote on that. There is one other piece of information, and I sent you all an email late this afternoon from a gentleman in town who wanted you to have this information. And so you all have it by email. And Myers, in order to introduce that into the meeting, do I need to read it or pull it up on the screen, or what would you recommend?
There's nothing, Doc, you're correct, Doc. There's nothing wrong with sharing things that are going to be talked about in this meeting. The concern was that there was any deliberation between any board members, any discussions, any reference to it before this meeting. So no, that's fine, Doc. You can introduce it. I will interject that it talks about the part that talks about the athletic events. Our schools are owned by the state. The state governs how the schools are run. We've got a local board of health, and they answer to the governor. So don't believe this board has the authority to make decisions on schools and the athletic events. Okay.
Yeah. So did you mean the Board of Education?
Board of Education, the Board of Education, and they answer to the state. And if I don't know that this board has the authority to talk about and make decisions on school matters. That's the easier way to put it.
Yeah, and
That's-
and then our recommendation has been that schools, when the schools reach out to us, that they follow the Department of Education guidance coming out from the state.
Thank you.
Which I believe they're doing. Yes, ma'am. I know who
This
that
is
was.
Diana.
Hi, Diana.
Is there any way that we could have more stringent ruling on the face mask? I just came up from Florida and they were a lot more stringent about going in anywhere without a face mask.
If this board so chose, we could. I think, listening to what Mr. Morton said regarding the liability of having something more stringent than the state has,
Yeah.
can be a challenge.
What's the state saying right now?
The state it's simply a recommendation. Continues to be a recommendation throughout their plan. There are a few places, that's one of the differences between our plan. There are a few places where we say you must wear a cloth face covering, and they say you may. And that would be a change, but it's not a big change. And for instance,
Who would police that? I mean, it's not something,
it's,
it'd be
you know,
hard.
you obviously hit a very interesting topic there. This is, nobody has the capacity, short of things we would never want to do, like martial law or something, to police all of this. Again, it goes back to people being empowered to make the choice, to do the right thing, to reduce risk for themselves, their community, and their families. I mean, that's really what this is about. And people are doing it. So I'm happy about that.
I agree.
Dr. Buchanan, I had one more question for you on one of the benchmarks, and that has to do with contact tracing.
Yes, sir.
Are we presently equipped in terms of funding and numbers of people to do the necessary contact tracing and to do it with some speed?
Sure. So it's a great question, and a little bit of background on that. Right now, the Knox County Health Department is in what we call our continuity of operations plan. So that means most of our services are being provided at a very limited scale. And so we've altered how we're doing services. So we've pulled almost all of our staff into the response. So right now, those positions are funded, and we're able to do that. One of the challenges we have is some of the staff are funded by grants, and those grants are going to make us start doing things that are to fulfill those grant requirements soon. We just had a conversation with the state yesterday about being able to access some CARES funding to hire additional staff to backfill as those people go back to work. So we have a whole plan for how to do that and plan to execute that so that we can reopen services more readily for our community over the summer. That'll obviously take time, but we've talked to them, and we're hopeful that we'll be able to get, if not all, most of the funding. Knox County has also been very generous in supporting our testing efforts so that they can be provided at no cost to our citizens, which has really helped take down barriers for some folks. So we're appreciative of that as well. So I feel like we're in a good position. If the state is not able to come through with the funding, we will have to look at some other things. We will not get services back up to 100% if we don't get that funding for those positions, because we just can't do it and still work the response appropriately. Because one of the keys to our caseload is that my staff is really quickly identifying those at risk, getting them in isolation, getting them in quarantine, and having great cooperation in doing that. So that makes a huge difference for our community. And so that needs to continue, again, for us to continue to move forward. So.
Thank you for that. Is there any other point that we need to discuss concerning the background? And I think we have kind of segged into the review and discussion of current plans and benchmarks. So in your agenda, there's or numbers 5 and 6, and I think we have covered those. Is there any other discussion about either 5 or 6 before we move on? Are we okay with that?
Just a real quick question. So if we decided that we wanted to go with a local plan, which it seems that is allowed per the ordinance or the orders. What do you envision the former task force playing a role? Because while I think it's great to have the board tasked with writing these orders, I'm pretty sure everyone on here has a full-time job, or at least most of us do. And so I think that that's probably going to be difficult. And not to mention, as I think has been noted by many, most of us are medical professionals, some with training in public health and things like that, and others without. But also, I think it'd be nice to have some of those business contacts that were on the task force. And so I guess my long-winded question is, Martha, what do you envision the task force's role going forward, if any?
So I think if we shift over to the, if your decision is to advise Knox County to follow the Tennessee Pledge, that task force would remain kind of in a consultation mode for businesses. They're already helping with that. They're answering questions. They're part of that team that also is answering questions for businesses as things change, and they're like, well, how do I do this? What have you, what things have you learned? So they'll stay engaged. They'll no longer, I would see them sunsetting and not, in no longer playing an official role in providing guidance to myself or to the board, unless the board wanted to keep that. And you certainly, Myers, again, I think that this board has the authority to say that, to empower me to convene a task force for moving forward. I think that the part of it is just the sheer amount of work of creating guidelines is pretty significant. Because, I learned all kinds of, businesses I never think of, they need guidance. I just don't go to those businesses, so I don't think about them. So that's why you need a lot of different voices at the table. And I think the advantage right now of moving to the Tennessee Pledge is really that they have that capacity. They have that depth at the state level to keep writing guidance and keep changing it. To be able to keep writing guidance and changing it for all the multitude of businesses that are out there is a real challenge. And so they're so similar. I think that moving to the Tennessee Pledge makes sense, logistically, time-wise, and honestly allows myself and my staff to focus more on some of the other things that we need to focus on. Not that reopening is not important, and not that guidance for businesses is not important, but if they're doing that work, we can focus on the contact tracing and housing issues. We have people who, landlords are going to start evicting people again. When you get COVID and you have to stay home for 14 days or 10 days, sorry, not 14 days, 10 days, or you're contacting, you have to stay home for 14 days, you might get evicted from your apartment. We've got to work with our partners in the community to help those families continue to have housing when the, rent forgiveness goes away, and other things that happen that we need to be focusing on. And so to let them do that, continue to do the work that they're doing, and, focus on the day-to-day response that we're doing here. And then in addition to that, I think you as a board, how do we use those? How do we use the benchmarks? How do you want to use those benchmarks? How do you want us to use the benchmarks in providing guidance to Mayor Jacobs or to the community or to, other leaders? That's a decision we'll need to make this evening as well. I think again, I've said before, I think the guidance is important, but that's a long answer to your question, but I would see the task force as a group kind of sunsetting, but staying engaged, because they're still engaged. They're still answering questions from businesses and troubleshooting and letting us know when people are having challenges as well. And they're aware. I've talked to them, all of them, and they're aware that we're meeting, and that there's a possibility that them meeting as a group won't happen again. So, and they're still engaged and helpful.
My only addition would be to reiterate, this board has the sole authority to decide how the community goes forward. This board.
So along those lines, and this will be my last question, and then I promise I'll stop. So if we decide that, yes, we're going to go with the Tennessee pledge with the statewide plan, do we still have the ability to use those benchmarks to step forward and backward away apart from what the rest of the state does? Or do we have to stick with what the entire state of Tennessee does?
It's whatever this board decides on, really. And our advice is, because of the immunities and we have in lawsuits, to not exceed, it's our legal advice not to exceed what the governor and what the state's doing. But it's up to this board on deciding what to do.
But so I guess if the rest of the state or most of the rural counties, they went into phase 3 and all of a sudden we saw an increase in cases here in Knox County, we could say, hold the brakes, we're going to stay in phase 2.
That's what this board has the authority to do that. Yes, doctor.
Martha, can I ask you a question? If we did decide to go with the Tennessee pledge, would a 14-day period be enough time for you and your staff to go from where we are now, just kind of hold what we're doing in the phase 2, as it's been called to this point, and for you and your staff to transition into the Tennessee pledge and to make sure that we're aligned at that point to follow along with that plan?
I'm sorry, I'm looking at Catherine because she's got a big piece of that as part of the Joint Information Center. And so did you catch the question, 14 days? So we believe we could be ready to do that in 14 days, if not less, but I won't commit to that. We'll say 14 days. Because it is a lot of moving parts.
You need longer. I mean,
I don't think we would need longer. No. And no, I don't think we would need longer. Not at all.
I mean, I'm of a mind that it sounds like a good way to go, but I also understand, as do the other people on the board, that if our situation locally changes, we have to take our responsibility as a local board to pull out of that and then to do what we need to do and to establish whatever rules we need to establish. But I'm willing to move forward with the Tennessee pledge, hold where we are to give you a 14-day period to transition, and then go from there, and then keep watching. I would like to keep up with benchmarks and make sure we're not going the wrong way. I don't want to be doing what, have the problems that Davidson and Shelby County and some other hot spots in the state have been having.
So I guess in thinking about that, what would the board keeping regular tabs on the benchmarks look like? Considering that this board, these meetings have to be sunshined, that takes time to happen, all of those things. That's up to you all. We have to meet the requirements of the meeting. But if we were to do that, what would that look like in your opinion? I mean, we certainly have the capacity to meet as frequently as you would like.
So Dr. Buchanan. Go ahead.
Do you know how often Davidson County and Shelby County are meeting?
I don't, and it's my understanding they're not sunshining their meetings, so they're more, they have a little more agility to call a meeting more quickly. So again, just different ways of operating. So maybe we need to, I don't know if you want to put that in the form of a motion, anybody, Pat, Dr. O'Brien, to say, the first part of that, and then we have the discussion about the data and benchmarks after that. Would that be okay with it?
I think that's reasonable. I mean, I do like having the benchmarks we have, but I don't know that it's required. If it would be something that is available easily to keep up with and to publish, so we as the board don't get behind the 8 ball and lose track of what's going on. That's my biggest concern if we're part of this bigger whole under the Tennessee pledge. So I'll go ahead and make a motion that we as Knox County move to the Tennessee pledge as our plan for the county to be implemented 14 days from today, with the transition period over that 14 days, and to remain in the current phase and plan that we have now during the 14-day period.
Actually, if excuse me, Dr. Buchanan,
can you explain?
Sorry, Dr.
Go ahead, Mayor Jacobs.
Yes, sir. Thank you. Dr. Buchanan, can you explain exactly the timelines for the local where we are now, phase 2, moving to phase 3 under local plan, where the state is, and the dynamic of if we switched over to the Tennessee pledge, how would that impact our timing if we were to move to phase 3 or whatever? Do you understand the question?
I think so, but feel free to ask me something
Okay.
else to clarify if you need to.
Sure.
So basically, I don't have the state's phased approach is very different than our phased approach. The state's phased approach is they are releasing new guidance periodically. They are using benchmarks to guide the governor in doing that. And so they're very similar to the ones we're using, but looking across the entire state, not just at one county. And so if we were to say move to phase 3, there aren't a lot of differences in the state's Tennessee pledge plan and what we have existing in Knox County right now, from the perspective of what people can and can't do. I mean, some of the very specific things that are different are that Tennessee's actually asking all restaurants to screen patrons for illness and fever. We're not doing that. So restaurants would have to start doing that under the Tennessee pledge. So that's a difference. Similarity is anything that requires you to remove a face mask isn't allowed at all. So does that answer your question? Because the way they're phasing is so different.
Yeah, I'm actually looking more at timelines. When are they looking at moving into phase 3, or do we know? And
it's a great question. That's a great question.
Okay.
We are not, those decisions are being made out of the unified command, is my understanding. And to be honest with you, we learn about those changes when the public learns about those changes. Right. When the governor makes an announcement or issues an executive order.
Yeah, because, and Myers, you can correct me if I'm wrong, but technically under the governor's executive order, we cannot be less restrictive than the state. Is that correct?
Mayor, first of all, our advice is we do not want to be more restrictive than the state. But as far as, I think, Mayor, the governor's left us out on our own to make our own mind up. I don't know that there is a requirement that we cannot be less restrictive than the state, Mayor. I think the mayor's let us loose with the 6 other counties that have boards of health.
And actually, I might be confused. I think that was under the executive order 30, which has expired. Yes. So I believe you're right. My apologies.
Actually, he renewed that and it continues. I mean, I'm pretty sure he renewed executive order 30. Anyway, there was an order at one time, and I thought I had it here with me, and I meant to have it with me, that did allow us to be either less or more restrictive than the state, which is a difference. We aren't normally able to do that. But I think, we could transition. I do think it'll take some time, and the 2-week time frame is a reasonable one for us to be able to get folks up and running and get our side up and running as well to be able to provide guidance. I don't think that puts us far behind the 8 ball with the state, Mayor, because I don't even know that has the governor announced phases, or are they just progressing forward? I haven't been aware that he's announced phases. I've been aware that he's issued executive orders and increased the number of people that can be in a gathering and all those things. But
right, it's mostly been done through executive orders. Yeah. That's why it can be a little confusing, because as you said, sometimes we find out when the public finds out.
Yeah.
If I may add one more point, and I'm sorry to repeat myself, but Knox County currently has no plan. There are no phases. Okay. I mean, if we're going to implement the Tennessee pledge, we're going from no phases, no plan to the Tennessee pledge. I mean, I'm talking legally.
Yeah, legally, not operationally. We've operationally been in a phase 2 plan.
You're correct, Doctor.
Yes.
I'm just talking legally. You're correct, Doctor.
Yeah. Now, one thing that people out there, and I would like to know, Tennessee pledge right now today versus our restaurant opening numbers. How many people can gather? Does anybody know what would be the difference for our restaurant owners in Knox County if we go with the Tennessee pledge?
Basically, that one I believe is very similar. Neither mentioned capacity anymore. Both are based on being able to spread the tables apart, encouraging outdoor dining. One of the differences is that we say that people must wear a mask. If 6 feet of distance cannot be maintained, that would be a change. The state says may. That's an easy change for anybody to do. And those businesses that wanted to continue to have their staff wear a mask can continue to have their staff wear a mask.
That's the only part that bothers me. I really like having that given where we're at. And really kind of wish we did have stricter mask requirements indoors in close quarters. But then again, how can we police that? We've got to rely on our citizens to do the right thing. And just for them to keep hearing, please take care of yourself, take care of those around you. We're all in this together.
Well, has he put a motion out? Do we need a second on Dr. O'Brien's? I'll second his motion.
So Diana, that was what I was looking for.
Okay.
We can now discuss that motion. I think we've been working around that discussion. And so this is specifically about the motion that Dr. O'Brien brought forth, which is to utilize in sort of a early as working order as we can, the state plan of Tennessee pledge for Knox County. So with that being made and seconded, any discussion? Hearing none, are we ready to take a vote on that? And the vote will be by roll call. So Narda, if we can have you go with us for a roll call on that vote, I would appreciate that.
Okay. Diana Drake?
Yes.
Dr. Gotcher?
Yes.
Mayor Jacobs?
Yes.
Dr. Hurt, excuse me, Dr. Maria Hurt? What are we doing?
You need to unmute yourself, Dr. Hurt.
Sorry. Yes.
Okay, great. Dr. Patrick O'Brien?
Yes.
Dr. Macy Souza?
Marcy Susie, yes.
Yes, I'm sorry. Lisa Wagner?
Yes.
And that's the end of our voting. Unanimously, yes.
Thank you. Thanks, everyone. One other item that we may need to consider, having looked at this main issue, and that is, as a board, do we need to delineate or further discuss the role of the task force, the county task force, now that we are going to utilize the Tennessee pledge? And we should just have a short discussion about that so that we can give the health department some guidance in use of the task force. Thoughts on that, please?
Who gets input from that task force? The mayor?
No, the task force was meeting to advise me on writing reopening. So we won't be writing reopening guidance anymore. So I'm not sure there's a need for that. Again, they are part of our team that is helping answer questions for businesses. So we have a team that is, working closely. Moving forward, we'll be working closely with the state and getting answers to questions so that we can get those back to businesses. The state is standing up some resources for businesses at this time. So that's good news. because we'll have access to those resources as well. So in not writing any more plans, really no need for a task force would be my thought, unless this board says otherwise.
So I wouldn't mind if we're going to be tasked with deciding whether Knox County moves forward or not, to at least have that task force available if we want input on certain issues. I don't know that they necessarily need to be, at every single meeting, but maybe at least be a resource in the event that, when we're actually reviewing those benchmarks on moving forward or backward, at least have them as a resource going forward.
So, I mean, it's possible to ask them to attend a Board of Health meeting. Like, we bring people in to inform you of other things at other times. So that would be one way to accomplish that. It would be in an open format. They're local citizens who are concerned about our community, and if able, I'm sure would happily provide feedback.
Yeah, I think that'd probably be fine.
Dr. Buchanan, how often would you expect that you would meet with the task force that you have presently without having them writing guidelines, but just to give you information on how things are going? And I would imagine if there's a critical issue that comes up, that would be deferred again to the board. Is that a reasonable approach for the use of the task force?
Well, again, I honestly don't see an ongoing use for the task force to advise me. Certainly, they are connected to us and communicating with us regularly, and bringing up concerns, which again we would bring to this board. So I wouldn't see that I would meet with them regularly. They have free access to my staff and to me, and can certainly bring things up of concern, just like any citizen can, that we can bring before this board. So that's how I would see that working. I think the bigger question is, for you all to decide is what frequency would you want to get together and be updated, they're on how we're doing, how things are going. Again, because these meetings require being sunshined, they're not as easy to say, have a last minute meeting, because of the requirements to have adequate time for the public to be aware of the meeting, so that if they do choose to watch, they can. Would your preference be that we go ahead and set a regular weekly meeting? It might be a 10-minute meeting to say, here are the benchmarks, we're looking good, and that's it. Or it might be a meeting where we say, here are the benchmarks, and debate something different. And I don't know what it looks like if we, say everything looks bad, or 4 of the 5 benchmarks look bad. And you as a board say, we need to stand still. If we're under the Tennessee pledge, I don't know, honestly, just being completely honest, I don't know what that looks like. Is it that you say, we stay here, and if the governor issues more orders, then nothing changes? I'm just not sure how. Again, it's about how we use those benchmarks. We've talked internally about different ways to use the benchmarks to inform the community. Some places have been looking at risk stratifying activities. So there's some activities that are high risk and some activities that are low risk. Obviously, staying in your house by yourself is a really low risk activity. But going to a party and gathering and not wearing a mask and socializing is a higher risk activity. Going to a ball game and sitting squished in there with a bunch of people is a high risk activity. Do we use that to say, kind of like, this is a very bad example, but kind of like when you're going swimming at the ocean and they put the flags up and it tells you what the danger level, the safety level of the water is that kind of how we use the benchmarks for our community to say, we're mostly green, keep doing what you're doing. We're moving in a different direction. Consider not doing riskier activities. I don't know. I'm not sure. I mean, that's obviously something we have to talk through and decide. But if you as a board are going to want to weigh in regularly on where we are with the benchmarks, I do believe that would have to be something that we schedule just because of the logistics, to be honest with you.
So traditional,
How would it be to keep doing the benchmarks and have us maybe have a set meeting every 2 weeks for a brief period of time, so it's on, sunshine, and that we can see what's going on. And then if something comes up that would be more emergent, which I don't think there would be, I think we will kind of know which way we're going, then deal with it. But I just want to make sure that your staff is okay to keep those benchmarks going and to allow us to see that.
Oh, yeah, the benchmarks are really important to us and our partners, and we use them internally to talk about what can we do different. And we use all the data that we have to discuss how do we reduce risk in certain populations. If you look at our data, you'll see that we have larger than our population Hispanic cases, and we're working really hard to reduce that. So we will continue to use very comfortable with our benchmarks and how they're informing our community, and are happy to meet with you all as often as you'd like. If every 2 weeks is fine, but I do believe that we need to schedule it. Just again, it comes to logistics. So I'm assuming you all would need to vote on that proposal.
traditionally, the board has met quarterly, and we have a number of topics, including budget and such, that we need to address. So there's a lot of things done at those meetings. And, my opinion would be this is an important enough critical topic for the community that it deserves undivided attention on a more frequent basis, not maybe a long meeting, but more frequent meetings. And so I would open this for a motion and then maybe some discussion about how we would engineer this. And, one example has been given of meetings every week, every 2 weeks, that they would be informational meetings, although we might, we would sunshine those meetings, and we might have things that we might need to act on, although it may be more informational. Thoughts from the committee, and then maybe a motion if someone so wishes.
I'll make a motion that we set up sunshine meetings every 2 weeks for a certain period of time in order to get the benchmarks to see how Knox County's doing.
So we have a motion, a second to that motion.
I'll second.
Thanks. So discussion. So I guess 2 points. Do we want to do this or not? And secondly, what's the frequency if we do it?
I think she said every two weeks.
2 weeks, yeah.
Okay. Any other discussion, any other comments about the motion for meetings from the board on a bi-weekly basis?
I think that's reasonable to do that and have that as a informational kind of COVID pandemic related meeting. Then every quarter we would have our regular meeting where we're dealing with those other issues, and do this as long as we need to until we get through this.
Any
Dr.
other?
B, does that seem reasonable to you?
That seems totally reasonable to me. Thank you. Yes.
Any other discussion? If not, I signal, see we're ready to vote. And Narda, if I can have you come on board, and we'll do a roll call vote again on this.
Yes, sir. Here we go. Diana Drake.
Yes.
Dr. Gotcher,
Yes.
Mayor Jacobs,
Yes.
Dr. Maria Hurt,
Yes.
Dr. Pat O'Brien,
Yes.
Dr. Marcy Souza,
Yes.
and Lisa Wagner.
Yes.
Okay, passed unanimously. Thank you.
So as your secretary, and we need to, there's some logistics. We need to be able to know what a good time of day would be. I don't anticipate, unless things are looking really concerning that these meetings will be terribly long, mostly informational. So is it an evening meeting that works best? Is it noon time, morning? Does it matter?
Doesn't matter. No.
Doesn't matter? Okay.
This was
Our
nice.
schedules are always complicated, but
Yeah.
does this time seem to work for everybody? 5 o'clock?
Did, yes.
Yes.
I think it's the mayor and Dr. Buchanan's schedule that might help us determine it. So if you two pick what you want, I think we'll live by it.
This time works fine for me, Mayor. Whatever works for you.
It's fine with me too. Thank you all. And your all's time is important as well. So this works for me if that's okay with everybody else.
Okay, so that settled. So 2 weeks from now, we'll meet again and we'll get that notice out.
I think we need to quickly have a vote on it. We were going to have a roll
Sure.
call, or did we already do that? Time flies.
I think we voted on
We
every
did,
2
we
weeks.
did,
We
we
didn't
voted.
vote on the date.
Right.
We just didn't
So-
set the date.
Any other topics to come before our meeting tonight? If not, we can have a motion for adjournment.
I do have one quick question. So, we operationally, we have benchmarks. We're going to use them to inform you to then provide guidance to us. So I think we're good with the benchmarks. Anybody have any input or thoughts on the benchmarks or changing them, or are we all comfortable with where we are? They really are kind of standard of what's being used kind of in varying ways across the country.
No, I like the benchmarks. One quick question though. So if the existing phase-in doesn't exist legally, what do we, for the next 2 weeks, like, do we need to approve that for the next 2 weeks so that we're not just running willy-nilly?
There are no
question.
benchmarks existing presently without this board determining there are.
Okay, so
Legally,
it sounds like the short answer is yes, that the board needs to express its opinions about keeping the benchmarks, not keeping the benchmarks, and phase 2.
Okay, so I'll go ahead and make a motion that that for the next 2 weeks, we stay under the current proposed Knox County plan, including those benchmarks, until we can phase into the Tennessee pledge.
So, go ahead. You guys need a second to have discussion anyway.
Dr. O'Brien, did you second?
I did second that.
So we have a motion and a second. Any further discussion on that motion to maintain present benchmarks and sort of administrative activity over the next 2 weeks as we transition?
Doctor, if you please, this is Myers Morton again. Dr. Buchanan, is that a screen that has the benchmarks on them that you can show? Does everyone on the board know what those benchmarks?
We actually just reviewed. We just reviewed them.
Okay.
Yes, sir.
That everybody on the board understands these are the benchmarks that they are deciding to use. We're for Knox County. Okay, thank you.
Yes. Everybody's in agreement on that. I think we've discussed that, but is everybody in agreement on our understanding of the benchmarks and in continuation of them? We're all good with that.
Yes, I think what has been called phase 2, whatever that is operationally, is what we are continuing and approving at this time.
Okay, so I do have one comment on the benchmarks. So we just voted to have a meeting every other week where we talk about the benchmarks. And in your motion, you said that we would stay with those benchmarks in the phase for the next 2 weeks. So in 2 weeks, we need to make a decision about keeping or not keeping the benchmarks. Just, I think.
I thought we really meant to keep the benchmarks all along, but what we're doing is for this 2-week period, we are reaffirming the benchmarks and the phase 2 operational plan. Is that right, Dr. Susan?
That was my motion, yes. So I want to keep the benchmarks forever until this thing goes away.
Okay.
Yeah.
This wasn't clear to me. So
I just wanted to make sure all of the parts were there.
So I'll ask the question. I know you guys, everybody got the link to phase 2. Have you had a chance to look at it? Do you have questions about it, concerns about it? Okay. Just
So-
making sure, you'd have the opportunity to ask those questions.
Any further discussion on that motion? If not, Nora, if you will help us with a roll call vote on that motion.
Yes, sir. Here we go. Diana Drake,
Yes.
Dr. Gotcher,
Yes.
Mayor Glenn Jacobs,
Yes.
Dr. Maria Hurt,
Yes.
Dr. Pat O'Brien,
Yes.
Dr. Marcy Souza,
Yes.
and Lisa Wagner.
Yes.
Passed unanimously. Thank you.
Thanks, everyone. Additional matters for discussion or any new business? If not, we can entertain a motion for adjournment and really appreciate everybody's help and input today. It's really
Sorry,
good.
I have a quick question for Myers. Myers, I just want to be clear so that we do everything appropriately. There was that email that was sent that I did forward to the Board of Health. They haven't discussed it. We didn't really discuss it at this meeting. Do we need to actually discuss it? Or can we just, what do we need to do with that?
There was, as long as there's no discussion, if there was any discussions about it among the board members, we need to start over and have those discussions again. If there
Right.
weren't any discussions, if there wasn't a matter that came up, then it's not a violation of the sunshine laws.
Okey doke. Thanks.
And also, so I'm clear, Dr. Buchanan and Myers, when Dr. Buchanan has information like that, she is free to disseminate it to the board, but we may not discuss it. Is that correct?
You are correct, Mayor.
Okay.
You're correct. There cannot be any deliberation. There cannot be any decisions
But she
made
can send the email saying that this is something to be aware of.
for next time. Yeah, well,
Or
there
whatever.
cannot be
Yes,
any
okay.
deliberations. Everything has to be done every decision made, every argument, every discussion has to happen at these meetings. And that was
Right.
the purpose of my email. And Dr. Buchanan made it clear to me that weren't any discussions. But you're correct,
Okay.
Mayor.
So just so everybody's aware that when we get in something from who Dr. Buchanan, most likely, we're not to respond or talk about it amongst ourselves with deliberations, correct?
Correct, Mayor.
Okay.
So we'll entertain a motion for adjournment.
So moved.
Yeah, excuse me. I
Great.
make a motion to
Second.
adjourn.
So thanks, everybody. This was really, I think, a very informational meeting. I think we've accomplished some good things in the time we had. And Dr. Buchanan, I guess our next meeting will be in approximately 2 weeks, and you will send out invitations by Zoom, I would assume, and
Yes, sir.
any other additional packages of information that we would need.
Yes, sir. And I'm happy to continue meeting by Zoom. It's convenient for everybody because you can, just stay in your office and not have to come here or go somewhere else. So as long as we're able to do that, that executive order may expire and we may have to move to in-person meetings. We'll have to find a place that's big enough for all of us to meet and maintain social distancing, but we can do that.
Okay. Well, thanks,
So
everybody.
thank you, everyone.
Thanks very much.
Thank you.
Evening.
Mhm.